Okay. Hello, everyone. We are Team 12, and we're doing ARIs, Prevention and Community Protection.
Wait, what button do I push? What did I do? I did something.
Hello?
It's
Is it working? Okay.
yeah.
Okay, what is an ARI? ARI stands for acute respiratory infection. Some examples of an ARI are pneumonia, bronchitis, and the flu. So our purpose here today is to help people in Bauchi by giving them ways to prevent themselves from getting ARIs. This is our team. I'm Armand Ali, and I'm from the northwest suburbs of Chicago.
I'm Shravani Gote, and I'm from New Jersey.
I'm Alexa Doty, I'm from California.
I'm Ellie Peng, and I'm also from California.
I'm Roger, and I'm from Chicago, Illinois.
I'm Riso Haller, and I'm from Gaithersburg, Maryland.
And I'm Ibrahim Saeed, I'm from New Jersey.
So how many people suffer from an ARI, and why should we prevent them? It's important to take any necessary actions to prevent an ARI. ARIs can compromise a person's health, or in some cases, an ARI can lead to death. In 2019, a study showed that 2.5 million people had their lives taken by an ARI. An ARI becomes even more dangerous if a person already has a health complication. ARIs are notoriously known for spreading fast throughout a community because they're an airborne disease. A study in 2011 proves that hand washing reduces present bacteria in your hands by 23%. Hand washing is one small step that we can take to prevent the transmission of an ARI. Prevention is key to promoting individual health, reducing any overload to the health care structures, and maintaining health in a community.
A key prevention strategy is proper personal hygiene. Some ways of maintaining proper personal hygiene include hand washing frequently, avoiding close contact with sick people, avoiding sharing personal items such as utensils to prevent the spread of germs, ventilating your home and keeping it clean, and making sure there's no smoke in it, sanitizing frequently used areas of the body, which include hands, drinking lots of fluids to stay hydrated, and keeping up to date on vaccines such as the MMR and influenza vaccine.
Okay. I'm going to be discussing the environmental interventions that can help us reduce our risk of contracting an ARI. So it's important that we're thoroughly washing our hands, maintaining a clean environment, and avoiding touching the nose, mouth, and eyes. Regarding enhancing infrastructure and resources, it's important that we establish primary care centers, improve hospitals for sanitation, and ensure access for the community to get their prescribed medications. Mandating certain vaccines in regard to the government policies and regulations are important, as well as issuing federal home ventilation standards and enforcing frequent hand washing in workplaces. In terms of global health, infrastructure is impactful because it determines the community's access to healthcare. So, for example, accessible healthcare facilities ensure that people are able to receive their necessary treatments and their vaccinations, as well as preventative care. And evidence-based laws and government intervention is important for effective decision-making so that the decisions are based off objective data instead of opinions or beliefs.
Intentional education is important because it can reduce the transmission of disease by educating residents of Bauchi.
Community engagement can allow for a safer community because hygiene can lead to disease prevention.
The overall benefit of the workshop is to educate residents on how to practice personal hygiene and also social distancing, which can reduce the transmission of ARIs.
Our workshop consists of 3 activities: an infection game for the children, coloring books with images promoting the prevention of ARIs, and an explanation and distribution of the educational placemats that we designed. All 3 of these activities incorporate simple prevention methods of ARIs. For example, The infection game teaches children to avoid contact with sick people. And the coloring books and placemats illustrate various ways that everyone can maintain good hygiene, thus lowering their chances of infection. Our target audiences are primary school children, most likely accompanied by their parents, and primary school teachers. Evidently, young children are highly susceptible to ARIs, so it is imperative to educate them on the many ways that they can manage their personal health. By instructing their teachers as well, they can be responsible for reminding the children to maintain these healthy habits.
The game will be infection, where the person who is infected has to infect others by touching them. And uninfected kids have to distance themselves from the infected ones.
So, what's the point of this game? We want the kids to learn that when a person is infected, you want to stay away from them and social distance themselves in real life. Also, at the end of the game, we want the people there to teach the kids about basic hygiene so that they can also prevent themselves from getting ARIs through being unhygienic.
Our second exercise is an educative coloring book. During this workshop, each student will be provided with a coloring book along with a pack of crayons. Before the coloring starts, there will be a hand wash demonstration. During this demonstration, the facilitator will show students how to properly wash their hands, which includes using soap, clean water, and washing your hands for at least 20 seconds. They will emphasize the importance of washing your hands as regularly, but especially after you use the toilet, after you touch garbage, or after you cough or sneeze. While coloring, the facilitator will also emphasize messages that are included in the coloring pages. For example, on the slide is shown a picture of a soap man. So this coloring page is supposed to emphasize the importance of using soap while washing your hands.
Exercise number 3, the educational placemats. To start off, the instructor will present the placemats while explaining which preventative measure each picture represents. Then they will proceed by distributing the placemats amongst the primary school teachers. They will instruct the teachers to store these placemats in their classrooms so that the students can access them during the day. Therefore, the children will have knowledge as to what the placemats represent and will be able to use them during the school day.
So this is just a breakdown of what we spent our money on to implement this workshop. We bought 15 placemats, which were $25 each, leading to a total of $375. We bought 20 coloring books, which were $3 each, leading to a total of $60, and 20 packs of crayons, which were $1 each, leading to a total of $20.
And these are just some more examples of the pages in our coloring book. So the top left picture, that influences the kids to stay away from those who are sick, while the bottom left picture shows the rights and wrongs when coughing, making sure that you're covering your mouth. And then the middle diagram just shows the dangers when sharing a drink with someone who's infected.
As previously stated, the educational placemats that we designed display images that show various ways that you can maintain good hygiene and prevent the spread of ARIs. So as seen, staying up to date of vaccines, covering your mouth and nose when coughing or sneezing, washing your hands, not smoking, and staying hydrated can all lead to a healthy and good personal hygiene.
All right, these are our sources. Thank you. Like, go down. Are you supposed to like go down? Do we stay up here?
Thank you very, very much for this wonderful presentation. I always love the introductory part where you introduce yourself as well as your topic. Okay, so I love how you introduce what ARIs are and how you can prevent them. The games and your workshop, I specifically love the coloring book. So it's very, very doable. Kids love coloring books. Okay, crayons, wonderful idea. They're cheap, and like I said, kids love to draw a lot. So paint, color stuff a lot. So I know she has to go. We don't have time to say much. All in all, it was a wonderful and amazing presentation, and I'm proud of you guys all. Okay, thank you so much.
Hi guys. That was a really good presentation. You should feel really proud of yourself. I would say it was really engaging. You all really look amazing. And I like how you kind of talked about the activities at the end and like highlighted it. What I would like more in the future is to see how well you can practice without your cue cards as much. I know some of you tried in and out, but it would be nice. In terms of your intervention and your activities, I think they will all work. They're doable. I would like if you could think about a way that it could also transmit towards the community. So just apart from your focus, kids, find a way that they could also talk to their parents about it. Maybe they could get an activity at the end of, okay, now that you know about SOPAN, go and tell your friends and your parents. Maybe your last page, because you want to keep up the news. And as of your placement, you really have to consider the age that you're thinking about. It's a great idea, but it's just fun. You have no smoking. If it's for under 5, is that the best picture that you want to use? Maybe think about placing that one with something else. Maybe like you have a lot of other things that you could place that picture if it's for a girl that age, because the idea is that they're probably going to smoke anyway. Apart from that, you did a great job, and I'm so proud of you. Well done.
Yeah, that was a very good presentation. Kudos to you all. Just for the first part of the introduction, we are discussing the issue of MMR and flu vaccines. Just remember, ours is mainly what? Bacteria, right? So your target should be, of course, vaccines for those permanent bacteria that causes ARI in Dutch, because they are making vaccines. Thank you. Well done.